Good afternoon, and thank you for joining us. We start again this week with the county in the red tier, but barely. As we mentioned last week, we're in a very fragile hold in regards to that red tier status. The incredible testing efforts that we've launched in this region over the last few weeks and the valuable partnerships that we've established with many of our community organizations to reach the underserved populations of our community have allowed the county to maintain a shaky grip on the red tier and avoid the purple tier. I know this weekly dance is exhausting for all of us, from the parent struggling to have their child homeschooled, to the small businesses owners that are trying to keep their business open. But there are no quick fixes to this pandemic, and we certainly cannot snap our fingers and magically come out of it. But what we can do, all of us, is to continue to practice the safety measures that we reiterate just about every time we have these media briefings. And that is to wear facial coverings, to maintain social distancing, and to hand wash on a regular basis. Until this crisis is behind us and the brilliant minds that we see in the medical and science fields come up with a vaccine, those safety measures are truly the simplest and most direct actions that we can individually take. This pandemic is affecting every aspect of our lives, and that includes the upcoming election day, which is now less than 2 weeks away. That's why today, in addition to Supervisor Fletcher and Dr. Wooten, we're going to be joined by a very special guest, our own Registrar of Voters, Michael Vu, who's going to explain the many steps that they have been taking to ensure that we protect the health and safety of voters and our election staff workers and volunteers. So to get started today, I'll first call up Supervisor Fletcher to kind of run through some of the information that he has. Thank you.
Thank you, and good afternoon. Yesterday we dodged a bullet as it related to the tiered structure. We could not have gotten any closer to the purple tier without tripping into it than we did. Our ability to remain in red was because of the state adjustment factor. This is a credit to our testing efforts, and it's a credit to the staff and our health care system partners that have ensured that San Diego County is testing significantly above the state average. Because we've been testing above the state average, the state adjustment factor has allowed us to stay in the red tier. But we don't want to live or die each week based on the tiers in the context of how many tests we've done. We want to continue to do as much testing as possible, but we want to slow the spread. We've seen other large counties, San Francisco in particular, descending to less restrictive tiers. They are urban environments. They have large population centers. And so we know that it is possible for large urban counties to descend and to move down into less restrictive tiers. That is the path and trajectory we want to be on. On Friday, we came, and as Dr. Wooten said, we wanted to sound the alarm about the concern about increasing cases. We want to reiterate that point today. We have to take action to slow the spread. We have to get those case counts moving in a downward trajectory. That will alleviate the weekly stress of where we will be, but it also put us on a path to a lower tier and towards a healthier fall and winter season as we go forward. We did have some good news yesterday as it relates to our health equity metric. This health equity metric is improving. Over the last 3 weeks, we went from 6.2, 5.7. Yesterday, it was 5.5. And again, that is a testament to a lot of focused and concerted efforts. Dr. Wooten will share some more on this, and we're about to be able to share our planning and efforts around this. But again, this health equity metric has the potential, if it continues to descend, in helping us with our overall tiered system and perhaps giving us a little bit of flexibility. But that number needs to improve, and we also want to see our case numbers improve. We're going to hear a little bit today about cases, about schools. We continue to work with our school systems on providing some standardization around the reporting of how many schools are open, how many students are back in place, and we're working on sharing our information about cases surrounding that, and we'll continue to provide more information as we work through that process. Another important announcement yesterday, the state made some more changes or adjustments to the purple tier. We certainly want to avoid going in it, and we're going to continue to work to avoid that situation. But personal care services, nail salons, tattoo, massage parlors are now joining other entities such as hair salons, where indoor operations are still allowable with modifications in the purple tier. We certainly hope to avoid that situation, but the state has revised and adopted a new guidance around what is allowable in the event a county finds himself in the purple tier. With that, let's jump into our daily charts today. You'll see our T3, again, really strong testing effort, and I want to commend our health system partners and our county public health lab and team for continuing to see increase in testing well above the state average. 14-day percentage of positives, new cases remain strong, 1.3 million tests, and we continue to do a good job on case investigation and contact tracing. Vital to the testing effort is the speed at which we turn around those tests. We've talked about this a lot, and so now I'll share updated numbers surrounding the turnaround times for testing. Again, continue to be really solid, 1 to 2 days. For our health system partners, our public health lab, our Helix partnership, the state's walk-in testing lab, family FQHCs are doing even a little better, between 1 and 1.5 days, and commercial labs holding generally steady, 2.5 to 3.5. Today's cases, we're reporting 263, and again, the individual day is less important and significant than the overall trend, but it is 263, about what it was yesterday, a little bit higher testing, 10,499 tests. We're reporting 3%, and again, you see that rolling 14-day average, and the purple line was heading down, went up a little bit, and again, we want to continue to see downward trajectory there. And the situation in the hospitals remains steady. 77 ICU-related COVID. You see the day-to-day fluctuations, but the general trends there are encouraging. 234 total hospitalizations, and then on the next chart, you can see that 234 in the context of all hospitalizations, again holding relatively stable and flat over the preceding month, and that is certainly encouraging. Same is true with ICU utilization, which you see here on the last one, our COVID-related ICUs, non-COVID-related ICUs, and again, those numbers holding steady. Up next, I want to invite, we have obviously an election coming up in a little bit less than 2 weeks. Our democracy works best when most people participate, and in a pandemic, when most people participate in a safe way. Our Registrar of Voters has worked incredibly hard to ensure that there are voting opportunities available for all eligible San Diegans to be able to exercise their right to vote. And with COVID-19, we are not going to let that get in the way of individuals' ability to exercise that right to vote. There's been considerable actions taken by the state of California and our registrar in providing every eligible voter an absentee ballot with postage paid. You can fill it out, drop it in the mailbox, your vote will be counted. There's a great tracking feature where you can go to the website and see the status of where your ballot is and if it's been received. We also have hundreds of drop-off locations. Our registrar will update you on those, but also talk about in-person voting, which is still going to be an option, and it will be an option that will be conducted in a safe environment, following all the guidance of our public health doctor, Dr. Wooten, and all of our experts. We want San Diegans to know there are multiple opportunities and ways in which you can vote, and our incredible registrar of voters, Michael Vu, will walk you through how that will be a safe environment and something that you should have confidence in participating in. Michael?
Thank you so much, Supervisor Fletcher. Let me introduce myself. My name is Michael Vu. I'm the Registrar of Voters for the county. Let me brief you. We are 13 days away from the election, but if you really think about the election itself, it's already begun. And I'm really encouraged in terms of what voters have been doing when it comes down to this pandemic. As the supervisor mentioned, we sent every single registered voter a mail ballot, and to date, we have 562,000 individuals that have returned their respective mail ballot back to our respective office. What that represents is 30% of all registered voters have already turned in their votes to our office. But that 30% also recognizes that that's 30% less that would potentially go to a polling place on election to vote and create long lines and crowding and also create a potential situation for exposure to the virus itself. So I'm very encouraged with those numbers, and if that trend continues, and I hope it does continue, that I see that our message is resonating with voters. Voters are ready to vote and return that respective mail ballots, as well as what the supervisor mentioned, which is to return it through the U.S. Postal Service, which has thousands of collection boxes that are out there, the 126 mail ballot drop-off locations that are out there, or should you want to wait, when our super polling locations are going to open on October 31st. So that's what I really want to turn the attention on, is now that we have released to voters their respective mail ballots, to start turning the story and the conversation around how we are preparing for voters should they want or need to go to a polling place on Election Day. Now, voters have been informed that there are going to be less physical sites than there has been in the past. We were anticipating that there would be 1,600 precincts, but due to the pandemic and to the response to that pandemic, we are now consolidating those respective locations into much larger facilities that allow social distancing over a 4-day period, as opposed to a 1-day period, on top of sending everyone a mail ballot that is out there. So if I can show you the next slide in terms of what we are planning. Now, when you think about this upcoming election, we become one of the largest employers for one day, and that's Election Day. But because of the pandemic, now it's going to be over a 4-day period when we bring on nearly 3,500 to 3,600 poll workers that will serve across that 4-day period. So I want to talk with you about those poll workers who have given of themselves and to commit to democracy in terms of allowing voters to vote should they go to a polling place, their assigned polling location on Election Day. So when it comes down to our health and safety plan, all of our staff, not just poll workers, but also our seasonal staff members as well as our permanent staff members, are submitting to screening. Every single day, they submit to temperature checks. They ask specific questions. We ask specific questions of them about anything related to COVID-19, and also screening for symptoms. Also, poll worker training is no longer just a 1-day affair or a 2-hour affair. It's now a 2-day affair. Poll workers are currently this week being trained over a 2-day course, as opposed to the normal 2-hour time frame in a traditional neighborhood polling place, to learn all that they need to do to ensure the health and safety of themselves as well as for voters. That includes the training and a module, all specially crafted, related to the proper use of personal protective equipment, also the ingress as well as egress of voters as they go to a respective polling place. When we talk about the personal protective equipment out there, I know that we've purchased 1,800 sneeze guards, 800,000 gloves, 300,000 masks, 25,000 tubs of hand sanitizing wipes, and 12,000 hand sanitizing bottles, all to be distributed to all of our 235 super polls locations, as well as here at the Registrar of Voters office. And also part of that is our clean and disinfecting protocols that we will have in place that our poll workers have been trained on. Now, what should voters expect? What voters should expect is that when they come on site, similar to here at the Registrar of Voters office, where we started in-office voting on October 5th, is that there will be clear signage about social distancing, about wearing your mask, about washing your hands and sanitizing before you retire and go inside the voting room area. Know that we have mapped out every single one of the 235 sites. We've created a site-specific plan, which I will cover in just a little bit. But that site-specific plan is crafted of how to lay out that respective voting room to ensure social distancing and to make sure that all of our personal protective equipment is laid out properly. Voters who fail or mistakenly forgets to bring a mask will be offered masks. They will also be offered gloves should they wish to use gloves as well. All of this, again, is thanks to our public health officials who have guided us through this, not just Dr. Wooten, but a couple of her staff, Dr. Seon as well as Dr. Ankita, who have worked with us through this entire process to make sure that it is safe and healthy for all of our voters. Certainly, there will be multiple check-in stations. Generally, at a polling place a voter goes to, there's only one check-in station to ensure that we are able to process and get voters their respective ballots to voters as expediently as possible. We now have, on average, 7 check-in stations at every single one of these respective locations. If I can get to the next slide. So, what are we recommending to all voters that are out there? If you are planning on voting in person, and we know that there are individuals that will be emphatic of wanting to vote in person, that's okay. But there are going to be individuals that need to vote in person. Those are individuals with a disability, perhaps. Those are going to be individuals that may have not received their mail ballot. They're going to be individuals that received their mail ballot, but made a mistake on it, and they need a replacement mail ballot. Or they may be an individual who failed to register on time by the October 19th timeframe, and they now want to exercise the same-day registration provisions that the law allows them, which is the act of registering and voting same day at a physical site. Voters should also be ready to bring and wear your mask. As I mentioned, if you forget your mask, we will offer masks there. Be ready to socially distance. And of course, this being the largest turnout elections in a 4-year period, and perhaps maybe the largest turnout that we've ever seen in San Diego County, be ready to have patience. Because if there is a long line, we want to make sure that you are prepared for that occurrence. Again, we're asking voters to distribute themselves. Every voter is going to be assigned one of the 235 super polls location. It's on the back of your sample ballot pamphlet. You can find it online. And we will also be sending a direct mailer to voters reminding them where their assigned polling location is. We want to make sure that of the voters that would go are going to be distributed across those 4 days, across those 235 super polls locations. And then next slide. All right, this is what it's going to look like in terms of voting in person. As I mentioned, before a voter enters the voting room area, they will hand sanitize in advance. Know that when they go inside, they will also be greeted with 7 check-in stations, which will have the sneeze guards. Each and every single one of our check-in stations will have sneeze guards. Our poll workers will be wearing masks and perhaps face shields in specific areas. There will be disinfecting protocols of any shareable items, whether that's the stylus that they would sign into, or the ballot marking device, which is the touchscreen units that we have. That there will be 7 on average at every single one of those respective locations, in addition to pre-printed paper ballots for those voters that go to their assigned respective polling location. And then on the egress side of this is when they exit and deposit their respective ballot, there will be an opportunity to sanitize there as well. So let me just say, again, the polling places will be open for a 4-day period as opposed to a 1-day period. And voters should know that. We want voters to be well informed about that. We want voters to vote early and to avoid any potential situation of a spike in the COVID-19 virus. Let me just say the election is November 3rd. I do not want to be standing here with Dr. Wooten 14 days later talking about Election Day as a statistic. And so for all voters that are out there, please keep yourself safe and healthy and vote that mail ballot and return it back to our office. Thank you so much. With that, let me turn it to Dr. Wooten.
Thank you so very much, and welcome everyone to today's briefing. Today, San Diego County is reporting a total of 53,263 cases, which is 263 more cases than reported yesterday. The age range is from 0 to 102 years of age. The age groups from 20 to 49 years of age make up the majority of all cases at 58%, or 30,699 cases. 27,300, or 51% of the cases, are female, and 25,829, or 49%, are male. 7%, or 3,080, of all cases have been hospitalized, and of this number, 879 of the hospitalized cases have been admitted to the ICU. 23% of the total number of the hospitalized cases also represent those that have been admitted to the ICU. The total number of cases also includes 863 deaths, or 1.6% of the total number of cases, and we had 6 new deaths reported since yesterday. 62% of all of our cases have been in the Latinx population. And of the 863 deaths, 823, or 95%, had underlying medical conditions, and 5%, or 40, did not have any underlying medical conditions. And the top 3 for San Diego's residents who have unfortunately died include hypertension, diabetes, and heart disease. Moving on to our triggers dashboard, community outbreaks continue to be the only metric that has exceeded the threshold. Today, we are reporting 32 total community outbreaks for the past 7 days, from October 14th through October 20th, and this represents 147 cases. In the next slide, as of today, 6 new community outbreaks were reported, and again, this represents 32 total outbreaks and 147 cases. In the next slide, it shows the outbreaks in the sector locations, which includes 2 in businesses, 2 in restaurants, 1 in a restaurant/bar, and 1 in a healthcare setting. Now, as a reminder, while the number of outbreaks in community settings is used in our trigger dashboard for surveillance purposes, and in an effort to provide as broad a big picture view of the region's COVID-19 status, it is not used in the state's evaluation of our tier status. And speaking of our tier status, in the next slide, moving to the state's blueprint for a safer economy, which is the tier framework with metrics and thresholds for each county to open more sectors. Again, the system is based on the levels of disease transmission, going from widespread, substantial, moderate, and minimal transmission, which represents tiers 1 through 4, respectively. As of yesterday, Tuesday, October 20th, San Diego County remains in the red tier, tier 2. Next slide. The county's COVID-19 unadjusted case rate for the week of October 4th through October 10th was 7.8, as you see on the left of the slide. The adjusted case rate is 7.0. The positivity rate increased slightly from 3% to 3.3%, and the health equity positivity rate dropped from 5.7% to 5.5%. With your help, we must make every effort to follow the recommended prevention strategies that I'll review shortly to reduce the case rate as well as the testing positivity rate. Now, this next slide is provided to drive home the point that we are too close to, for comfort, to the purple tier. And with the state's corrected calculation earlier this week, we again remain in the red tier. But we cannot be guaranteed that we will continue to be in the red tier unless you do your part. In this next slide, it's a summary of how close we are coming to the purple tier. And as you can see here, the red box is, those are the metrics that were submitted to the state on Sunday and released to the public on Tuesday. And each day our epidemiologist calculates the 7-day average after a 7-day lag. And after the red box, these metrics are Monday, Tuesday, and Wednesday. And for today, you can see that 1/10 of a point the rate decreased, but we can do more to make sure that the unadjusted case rate is below the dotted line and at least 7 or less. So that is our goal going forward. And we need all of you to help make this happen, to decrease the number of cases that are reported. Now, as a reminder, the county developed and submitted its health equity investment plan to the state last week. We documented current and ongoing activities across these 3 strategic categories. And in the next slide, it shows the various areas under the strategic categories, from immediate strategies, long-term strategies, to cross-cutting strategies. And we documented, again, all of our current and ongoing activities, as well as future or planned activities for these same categories. And once the state has reviewed the plan, we are told that the document will be published on the state's website, just as they did with our San Diego County attestation form. Now, next, I want to remind people about the importance of getting the influenza vaccine. If it is recommended for everyone 6 months of age and older, and if you are not able to get a flu vaccination from your healthcare provider, the county is offering vaccination sites starting tomorrow, October 22nd, through November 3rd. After that point, they can also be obtained at our county public health centers. But please protect your community, protect your family, and protect yourself from getting the flu, and get your flu vaccination. Now, moving to information about schools in the next slide. Last week, the San Diego County Office of Education updated their public school district in-person reopening report with the data as of October 20th that you see here. This slide shows the updated numbers for the 42 school districts reopening status. And here we see that 31 districts are open to some or all students. One district will reopen on October 22nd, one will reopen on October 26th. 3 plan to reopen in November, 4 are targeting to reopen in January next year, and there is currently uncertainty for the reopening status of the remaining 2 districts. This information will be reported by the San Diego County Office of Education every 2 weeks. The next slide shows a summary of case data for school-related exposure at private, charter, and public schools, preschools, and institutions of higher education. Again, this information is only for on-campus learning. This information is updated weekly by the county in our COVID-19 watch that is released or published every Tuesday. Cases are provided for the past 2 weeks in the middle column, October 4th through the 17th, and then cumulatively from June 5th through October 17th. Of those interviewed during the case investigations and contact tracing, you'll see in the middle column, 2,848 individuals were reviewed for this 2-week period, and it was determined that 125 or 4% had a school-related exposure, again, either preschool, K through 12, or universities. Of that number, 39 specifically had exposures in K through 12 schools, or 1.4%. Of the, on the last column on the right, 33,854 people were interviewed for exposures from June 5th through October 17th. 793, or 2.3%, had a school-related exposure at the 3 locations, and of that total, 166, or 0.5% of cases had exposure specifically in K through 12 schools. So as you can see from these data, the number and percentages are relatively small for the categories we reported. As a reminder, we can and will address the challenges of COVID-19 successfully, and the following simple preventive measures have been proven to be successful, and we want to continue to iterate, continue to emphasize the importance of these preventive measures. If practicing good hand hygiene and sanitation, keeping 6 feet apart, wearing a facial covering, avoiding large crowds, gatherings, and one of the most important, staying home if you are sick. All of these preventive measures can help decrease our testing positivity rate, can help decrease our case rate. And in the next slide, by decreasing these 2 metrics, we can open up more business or various sectors. But in opening up these sectors, we must practice these preventive measures, or otherwise we will see ourselves back in the purple tier. And in this next slide, I'd just like to remind everyone of how far we've come. Now we have more sectors open, but we can only open more sectors safely if our case count decreases. On the left of the slide, it shows where we are now in the red tier with the conveniences that this tier status affords regarding sector and business operations. However, if our behavior does not change, we could see the county going to the purple tier with limitations in business operations as seen on the right, eating outdoors as opposed to enjoying both indoor and outdoor dining. So again, do your part, wash your hands, social distance, wear your facial covering, and stay home if you're sick. Thank you. Now please welcome back to the podium Chairman Greg Cox.
Thank you, Dr. Wooten. We're going to go directly to the questions.
Yes, this first question is from Taryn Mento with KPBS. Please state your question, Taryn.
Hi, thank you. I actually have two. Dr. Wooten, you just showed a chart showing the case rate calculations for multiple 7-day periods, but the next assessment from the state will be for the week October 11th to the 17th, and you all have a lot of that data. What case rate are you calculating for that specific 7-day window right now?
Dr. Wooten?
Well, we won't calculate that case rate period until Sunday. That's why we are calculating the rates on a daily basis so we can see where we are, and it gives us a perspective of what the Sunday calculations may look like.
Thank you. And my second question is, the Supervisor Cox said it, you reiterate it every single time, these tools that we're continuing to rely on, face covering, social distancing, they don't seem to be slowing down spread enough because we continue to remain very close to the purple tier. Is the county planning any new tactics to address the rise that you're all seeing?
Well, I can just share that we have implemented public education campaigns that are focused on various populations, and the county can just do so much. It really is going to require every individual, every business, every other sector to do their role. So as individuals go to various businesses, ensuring that their patrons wear their facial coverings and social distance. For various businesses where groups gather, not allowing people to gather at the bar or to gather in large groups or to have parties, or it just, again, everyone has to do their part, and it's not just the county that has the role. We can tell you what to do, we can tell the community and educate the community, but when it comes down to it, each individual person has to take responsibility and follow those guidelines.
Thank you very much.
Okay, next question.
This next question is from Brandon Lewis with CBS 8.
Thank you. I actually also have two questions. The first is the county adjudicated its case rate before it came out this week, specifically with the number of cases. Could you tell us what the county found incorrect in the state's numbers and why the change happened?
Okay, Dr. Wooten's going to respond.
Thank you for that question. In the definition of cases that the state accepts, we are informed or instructed to exclude federal and state inmates. So what we determine is that the calculations that the state originally prepared included 2 cases from a particular federal prison. And that was the information that was corrected. So those 2 cases were removed, and that is what resulted in San Diego County going from purple to the red tier.
Thank you. And my second question is about influenza. In the influenza watch, it looks like there have been flu vaccines given this year compared to this point over the last 2 years, while there are also fewer confirmed flu cases. Can you give us an update on the prevalence of influenza and whether there's any cause for concern that vaccinations are starting to drop off a little bit earlier than the previous 2 years?
Well, it's too early to provide any predictions. And as every year when I'm asked by the media about what do we think this flu season is going to look like, the only thing that's predictable about the flu season is that it's unpredictable. So last year, we actually, the entire county, not just the county of San Diego, last year we received 55,000 doses from the state for our vaccine for children and vaccine for adult programs. And with our local healthcare providers, we vaccinated over 1.2 million, which is the highest number of cases that has been administered in, the highest number of vaccines that have been given in San Diego County. To date, the year before, it was just over 900,000. So we are, as I shared with you, we're getting started with our pods. We are disseminating the vaccines that we are getting from the state to our community partners with over 100 memorandum of agreements with various partners so that they can administer the vaccines to their constituents or the populations that they deal with. So again, it's too early, and we will continue to update the community in the influenza watch. This was the first flu watch that was released, I believe, the first or the second. So we will continue to monitor that information. So the current information that you've just stated, really, I wouldn't use that for right now to make any predictions. And Dr. McDonald is also here.
Sure. I just, since you asked about the flu watch and our first issue just went out today, I thought I'd just make a couple quick points about it. First is that to date for this flu season, which started July 1st, we've only had 10 cases reported in San Diego County, and that compares to 320 at this same point last year. So a significantly lower number of cases so far this year compared to really any previous year. And the point that you made is that we are ahead right now on the number of individuals in San Diego County who have had a immunization and had that immunization registered in our voluntary immunization registry. And to date, it's 637,000 San Diegans who've had their vaccine so far, but we need to keep going. There were over 1.2 million San Diegans who had their shots last year, and we would like to get as many of those people and more as soon as possible this year to protect ourselves through the entire season.
Thank you, Doctor.
Okay, next question.
Yes, this next question will be from Alexis Rivas with NBC7. Alexis? Okay, let's move on to the next one.
Oh, I muted myself, sorry. Is it too late?
Nope, go ahead.
Okay. I was covering the presser last Friday, when we were talking about just how close we are, too close to comfort to this purple tier. And I remember last week, a reporter asked, if there was any indication about what might be driving that spike in cases. And, at the time we were told there's really no singular reason that we know of. I'm asking now on Wednesday that we've had time to do a little bit of contact tracing. Is there any idea what might have contributed to that bump in cases that's getting us so close to this purple tier?
Okay, Dr. Wooten's going to respond.
There is no single event. What's happening is people are lowering their guards, going back to how they functioned before COVID-19, going to gatherings, gathering at people's homes or at public locations, and not adhering to the preventive strategies that we talk about every Wednesday and in every press release that is issued. So there's no one event. It is across the board, the behavior, And it doesn't take a large effort here. As you stated before, the difference between us being in red and purple tier this week was 2 cases that should not have been in our count. So if people will just make the smallest of efforts by wearing their facial coverings, social distancing, and not going to parties, large crowds, or large gatherings, we can turn the tide here and can remain comfortably in the red tier, or even lower, advance to a lower or less restrictive tier, the orange tier. We are testing, and that is certainly helping. Supervisor Fletcher mentioned San Francisco. They are testing a lot there as well. But I want to keep in mind that San Francisco is a third of the population of San Diego County, less than 900,000 population, whereas we have 3.3 million population. So, but those strategies that I mentioned, and it might sound as if we're preaching, but we just want everyone to take responsibility and to do their part to help move the curve. And also, Dr. McDonald would like to provide some comments.
Yes, thanks. Thanks, Dr. Wooten. I couldn't resist jumping in because it gives me a chance to plug our other publication once a week, which is the COVID Watch, which we put out every Tuesday. And actually, if you look at our COVID Watch and look at our confirmed cases by age group, you'll notice that between weeks 40 and 41, and weeks 41 is the one that we were just adjudicated on for our tier status, there's an ever so slight increase in the number of cases between the ages of 0 and 19. And if you think about it, that makes a little bit of sense. There are more kids going back to school, doing a little bit more activities, and the other age groups relatively stayed the same between weeks 40 and 41. So if I was going to concentrate on one place and give you a take-home message, is as more kids return to school, it's very important that we follow the guidelines that the schools and the school districts are giving to keep kids prepared. And that starts with getting the kids ready to go, traveling to the school, being at school, and then coming home, and then any after-school activities in which they may be involved with other kids. I mean, our local school districts and independent schools have done a great job creating plans, but we need to make sure that parents know those plans and can get their families to adhere as closely as they can to those plans. Again, there's no specific outbreak that I'm referring to. It's really just a slight increase, and if I think moving forward, what gives me some concern is, again, with increasing numbers of kids returning to school, that would be a place for parents to spend some effort with prevention.
Thanks so much.
Okay, we have one final call-in question.
Yes, this call will be from Paul Sisson with the San Diego Union Tribune.
Hi, thank you. My first question has to do with the chart you put up titled COVID-19 Potential Exposure Settings. This is in schools. It says that there were 2,848 exposures in the last 2 weeks. What I don't see here is positive cases. So can you tell us how many positive cases are involved in these, that kind of generated these exposures?
Okay, Dr. McDonald's going to respond.
You know, thanks for asking that question. That chart that Dr. Wooten showed is actually an excerpt of a larger chart which shows exposure, potential exposure settings in many different locations, everything from beaches to work to households to, in this particular case, the school information was excerpted out. Actually, that table doesn't have the total number of confirmed cases reported during those 2 weeks, only the numbers that were interviewed, and I think moving forward we'll add that information. I don't have that number off the top of my head, but we can supply it to you, Paul.
Okay, and another one, this is regarding the polling information that was shared a little earlier, very interesting. I wondered about the sanitation procedure in polling places in terms of shared surfaces, you know, voting booths, I guess pencils, maybe ballot holders, you know, the various things that people will touch as they move through the voting process. is there a sanitation plan to make sure that that stuff is sanitized in between uses regularly? Can you say more about kind of how that will be done?
Thank you, Paul. The answer to that question is yes. As I referenced in my remarks, is that every single location will have a site-specific plan. It's upwards of an 8-page document. A portion of that document talks and spells out all the various sanitation protocols that will occur at every single one of our SuperPoles locations, as well as how that respective site has been laid out. Not only have we been preparing for the election in terms of issuing ballots to voters, but we've been surveying every single one of these SuperPoles locations, specifically the voting room area, and working with all of the facility owners to lay out the respective locations to understand how the process flow of a voter would go inside the voting area as well as out, and then also spelling out the intervals of time of when items should be sanitized. Certainly, hand sanitizers will be available, and also all approved hand sanitizing wipes will also be provided at every single one of these respective locations. The shareable items that you spoke about include styluses, the electronic poll books, which we will be deploying, which is expanded technologies that we used at our satellite locations during the March election, and certainly the ballot marking devices as well. When it comes down to the use, single-use items like the gloves, as well as the secrecy sleeves, those will be, again, single-use only, and then all other products that are shareable will be wiped down before the next person uses it or touches it.
Thank you.
And I wanted to run back up. Actually, the table I referred to in my COVID watch actually does have the total number of positives for that week, Paul, so I'll give it to you right now. It's 3,914.
And that's across all schools, K-12 and universities?
No, that's the total number of positives for all San Diegans during those 2 weeks. So that's the denominator.
I guess what I was wondering is what it is for the schools, since you were talking about exposures in schools.
Oh, how many individuals have been in schools? Is that the question that you're asking? I mean,
how many individuals have tested positive in schools?
Oh, how many individuals have tested positive in schools? Well, that's actually the number that's on the cumulative side on that table that Dr. Wooten showed. Of those who tested positive, who cumulatively since June, who endorsed a K through 12 exposure in the 14 days before becoming ill, it's 166. Is that the question you're asking?
I mean, this indicates that these are exposures, not positive.
No, these are individuals who are known to be confirmed cases. Yes. And then they're asked about the exposures that they had in the 2 weeks prior to becoming ill. And,
I see. Okay.
And yes, and so we ask about lots of different kinds of exposures, and we're not saying, I'm going to be very clear, we're not saying that the person was known to be exposed at that location. These are just potential exposure settings. We ask about a lot of things. Again, we ask about gyms and retail and work and going to places of worship. And again, I refer you to that table to see the different types of things that we're asking about for potential exposure settings, and an individual may list more than one.
These are where people who tested positive were potentially exposed.
That's correct.
Got it. Thank you.
That completes the call-in questions. We have 2 texted questions. This first one is dealing with businesses encouraging their employees to get tested more frequently, and Dr. Wooten's going to respond.
This question is from Derek Stahl with ABC 10 News. Many businesses are concerned about the county sliding back into a more restrictive tier. Since San Diego County's tier status depends in part on testing rate, would it be helpful for businesses to encourage their employees to get tested more frequently? In other words, could businesses essentially cancel out a high case rate with widespread testing, and would you encourage this?
Well, that's a very interesting question, and actually is one that we have had some preliminary discussions with in terms of the restaurant industry. But again, the one sector, which is schools, that the state is currently recommending for routine surveillance testing, But unless we're in a bubble, you really can't test your way out of COVID-19. What we are doing with our T3 strategy is to test those groups and individuals that are at highest risk. And we are continuing to do that. And there certainly is more room and opportunity there, but I think that certainly is a discussion that we can take up with the Restaurant Association. But the important thing is to test, first of all, those groups that are at highest risk, the skilled nursing facilities or congregate care facilities, healthcare workers, first responders, as well as individuals that are in low-income areas. And as you know, our health equity metric is focused on making sure that we have accurate testing in those lowest quartile communities. So those are all strategies that we are working on and that we've done a lot of effort related to those populations, but certainly we are doing more. Any other comments?
This next question I have is from Mike McKinnon with KUSI News. He asks, the World Health Organization now advises against lockdowns due to economic and health effects. Do you agree or disagree with the World Health Organization's new stance on lockdowns, and why?
Well, it is not my job to share what I agree or disagree with, but to follow the guidance that we get primarily from the state. And we've gone the lockdown area, and we saw the economic instability that caused. When our numbers, our case rates decreased, then we opened and we learned our lesson about opening too fast. So we essentially locked down again, and now we are going at a more intentional, slow rate. And even with this, and we've been talking about this in most of the Q&A, we still have an elevated case rate. So if individuals will all do their part, if businesses from restaurants to schools to other employers, governments, everyone doing their part to implement these preventive measures, not allowing people to come to work when they have symptoms, and people taking the personal responsibility not to go to work when they are symptomatic. I think we can turn the table here and help to decrease the spread of COVID-19 and decrease the local transmission and number of cases.
Thank you, Dr. Wooten.
Well, that completes our calls for today. Before we adjourn, I just wanted to take an opportunity to remind people that we're getting a little cooler weather, which I think everybody is glad to see. This particular weekend, we're actually anticipating some rain on possibly Saturday through Monday morning. And so the one word of caution I would encourage people, if you want to go out and get tested, we have 60 different locations throughout San Diego County. A few of those are set up outside, and if it is raining, we will not be able to operate those facilities because we have generators that are going to be out in the open. So if you are planning to get a test this weekend, we would encourage you to check with 211, call 211, or better yet, get on their website, and there will be current information in regards to those outside sited testing facilities that may be closed down if the weather is not conducive to operating them. So with that, we will conclude the briefing for today. We'll be back here next Wednesday at 2:30. Until then, please be safe, San Diego, and wear those masks, observe social distancing, and avoid large crowds. Thank you.